I'd like to call upon Dr. Tayyab Rashid. And Dr. Tayyab Rashid, he is a licensed clinical psychologist and researcher at the University of Toronto Scarborough campus in Canada. Dr. Rashid's expertise include positive clinical psychology, strength-based resilience, post-traumatic growth, multicultural psychotherapy, and positive education. Dr. Rashid completed his clinical training at the Farley Dickinson University, New Jersey, and at the University of Pennsylvania, where he developed empirically validated positive psychotherapy with Dr. Martin, the founding father of positive psychology, and one of the leading experts in optimism and well-being. Dr. Rashid's research has received numerous honors and awards and has been published in peer-reviewed journals, and he has also been featured in the Wall Street Journal, CBC, Globe and Mail, the Toronto Star, and TED Talks, etc. Dr. Rashid has presented and trained mental health professionals and educators internationally, including not limited to Princeton University, the University of Paris, the University of Melbourne, the University of Hong Kong, etc. Dr. Rashid consults and serves as a board member on several non-profit community organizations. He has also worked with trauma victims, including the survivors of the Asian Tsunami in 2005, the 9/11 terrorist attacks, and the floods that happened in Pakistan. Before joining the University of Toronto Scarborough campus, Dr. Rashid worked as a school psychologist at the TDSB, the Toronto District School Board, and also as the Director of Applied Research with the Values in Action Institute in Cincinnati, Ohio. And inshallah, Dr. Rashid will speak in English and in. So now I call upon Dr. Rashid.
Bismillahirrahmanirrahim. Thank you for the lovely introduction. A lot of things that I wanted to say, my esteemed colleagues have already said and stolen the thunder. So I kept on revising my talk. So let's see how that goes. Let me start with one of the things that I realized is anyone sitting in this audience, brothers and sisters, who has never been sad, who's never been stressed, never been angry, never been afraid, never been ambivalent, unclear. आप में से कोई ऐसा शख्स, बहन या भाई, जो कभी भी sad, जिसे हम कहते हैं उर्दू में कहते हैं उदास, stress का मुझे उर्दू में नहीं आता, तनाव नाराज, गुस्से में ना आया हो, ambivalent, just पता ना चल रहा हो, indecisive करके, खौफ से डर, ये सारी human states, attributes we all experience day in, day out. And our holy book, the Great Quran, actually talks about some of these psychological states. Quran Park in states as a 70, verse 70, ayah 19. Truly, man was created impatient. आपको पता होगा impatient का क्या मतलब, जल्दबाज. और हमने से, I don't need to tell you how we are living in an age of anxiety, जिसमें जल्दबाजी, हर चीज़ जल्दी करने की हमें pressure पड़ता है. Surah 7, verse 10. قليلا ما تشكرون. कितने हम में से कितने लोग हैं जो कि बहुत सी हमारे पास blessings, facilities हैं, but how many of us actually say truly are thankful for it? Quran Park also zikr karta hai, it also mentions in Quran Park that man in the modern linguistic terms would be human being is greedy. हम हर चीज कलेक्ट करना चाहते हैं. एक्चुअली नए DSM-5 जो कि कलेक्शन है मेंटल हेल्थ डिसऑर्डर्स की, उसमें होर्डिंग डिसऑर्डर, होर्डिंग का ज़ख़ीरा अंदोज़ी जिसे कहते हैं, hoarding disorders is one of the things. And I see these things day in, day out, रोज़मर्रा की ज़िंदगी में, interactions में देखता हूँ. 4 दिन मेरा काम है, for 4 days I counsel and I work as a clinical psychologist at University of Toronto, Scarborough, इसी community में, and most of my clients are actually from South Asian, Afghan, East Asian communities. A number of them are, about 30% these people, they are Muslims. Majority of them females. Females counseling के लिए ज़्यादा. तो उनमें से कुछ आपको scenarios present करना चाहता हूँ कि mental health का issue जो है हमारी community में कैसे impact कर रहा है. Now this is not, first one is not my client, it's just someone that I know. I will also be very careful and alter some details, कुछ तफसीलात change कर दूँगा ताकि उनकी confidentiality को honor कर सकूँ. First one is a 50-year-old male, divorced, worked in another country, another part of the world for many years, and then immigrated to Canada, and he has weight issues. Recently, he's diagnosed with hypertension. उसकी भी properties are तर्जुमा करने की ज़रूरत नहीं है. Now, this male, अब आके इस male को अंदाज़ा हो रहा है कि for a long time, he has been experiencing different states of depression, different phases. Depression ऐसा नहीं कि वो सिर्फ depression doesn't just come and go. It comes in waves. So you have a phase for 5 months, 6 months, and then you go again. So it's up there. But if this gentleman has some awareness about mental health, the things would be very different. If that awareness or viable treatment option, अच्छे treatment options available उसके पास होते, तो आज situation बहुत मुख्तलिफ होती. बहुत सारा family में इस depression की वजह से damaged. Lots of things have been damaged. Second one is, and it's again I will change the details, is an 18-year-old female. When I start seeing her, she's in full hijab. She's observing Salat al-Sawm, namaz purged. But again, not finding peace within. Kuch sessions ke liye bachche मेरे पास, and then after a couple of months, I saw her again. कुछ महीने के बाद बारह महीने से देखा तो completely different person, no hijab, and that was a new identity she was looking for. Again, lots of family issues. Again, I won't go into the details of that. So keep this male and female, which is primarily this transformation. This happens within this female over a couple of months' time because of the family turmoil, family major masail thing. The third one is a Muslim young male, and very intelligent, bright, finishing graduate degree. Comes to me, and I've saw him for a very, very long time, and the issue is this young man is also quite spiritual, religious in many ways, dating a female from a non-Muslim female from another culture. And it's a family from South Asian Muslim family, and the mom said no. ये शादी तो नहीं हो सकती. Over my dead body. I mean, it's not a film, Indian film with that dialogue, but it actually I've seen that, and the turmoil that followed is astounding. All these three cases, again, if culturally appropriate, awareness to these kids, to these individuals, to these families was available, lots of things would be different. Our community, some of you have been living in Canada, born and living in Canada for many, many years, faces numerous challenges. Stress ka लगता, anxiety ka लगता. One of the big challenges that I see with kids, I mean, I know kids who get going through counseling, psychotherapy, one of the biggest challenge that I see with them is about what is the technical term called acculturative stress. इसको उर्दू में तर्जुमा में क्यों होगा? Actually इसका तर्जुमा करना आएगा कि नहीं? जब आप एक कल्चर से दूसरे कल्चर में जाते हैं, मूव करते हैं, और उसके नतीजे में जो स्ट्रेस होती है, the stress of moving from one culture to another. So there are usually, if research shows that you can do 4 things. The first is you assimilate. Up उस culture, most of your life, you leave your old identity, पुरानी शनाख्त, पुराना culture, leave it behind, and उसी के रंग में आप डाल जाते हो. Second one is separation. You become so afraid of the new culture that you isolate and you don't interact with the new culture. नए culture के साथ आपका ज़्यादा interaction होता है. The third is marginalization. ना आप पुराने culture के साथ रहते, associate रहते हो, ना नए culture के साथ. वो एक अलग ही state है. All these 3 states produce mental health, zihni, nafsiyati problems. And I will also underscore that I am not, by any means, to my colleagues who just spoke very beautifully about the suburb. My perspective is coming from the more Western concept of mental health, and I'm maybe training to more Western psychology के एतबार से, and I'm trying to integrate our cultural perspective into it. When I was in Pakistan, I went to Government College Lahore, I did my master's, and it's called Nafsiyati. So again, we had a wonderful discussion about, in Islamic tradition, it's more about nafs, and there are 3 kinds of nafs which Quran tells about. But my talk, the focus of my talk is more practical, that how can we bring the current understanding of mental health, which is prevalent in our Canadian GTA society, and how we can culturally adapt to it, so it becomes more meaningful for us. Okay? So, the states show 3 states the way I was telling about culturation stress, among other things. When those states do not resolve, what do you see in yourself and in your children? Stress, anxiety, and mental health issues. And by every year, I also conduct clinical research. By every year, we are seeing more and more complex. जो नफ्सियाती problems हैं, वो ज़्यादा पेचीदा होते जा रहे हैं. They're becoming more complex. Numbers ज़्यादा increase नहीं हो रहे हैं. It's the complexity which worries me. So it's the kid, 18-year-old Ahmed, Salma, Luqman, when they are coming to me, they just don't have simple garden variety depression. उन्हें depression में भी मिल रहा है, anxiety भी मिल रही है. Now our kids are also reporting lots of self-harm, which Brother Yassin was talking about, and very high incidence of suicidal ideation. Attempts भी बढ़ रही हैं, but ideation के ये सोचना कि मेरी ज़िंदगी बेकार है, मुझे इसे ख़त्म कर देना चाहिए, and वो persistent रहते हैं. तो हम लोग क्या करते हैं? हमारा typical response क्या होता है? हमारा typical response ये होता है, pray with more devotion. Perhaps तुम्हारी नमाज़ों में दम नहीं है, तुम्हारी इबादत में इतना वो अल्लाह जैसे चाहता है, you are not praying that. So that's one typical response among many others. Second one is we also seek spiritual remedies and spiritual solutions, which of course are valid. And as we talked about, there is a documented science of the self. Mindfulness is a new field. आजकल mindfulness का meditation का बहुत fashion है. But in Islamic tradition, when I was studying, we actually had a course in Islamic spiritual psychology. Muraqabah, some of you might have heard about it. Meditation, that roughly translates to that. But there are unfortunately not very many learned scholars and practitioners of Islamic spiritual healing. So, तीसरा ये होता है, third one, which I see in lots of my clients, is a great deal of distrust. जो traditional mental health के आपके पास resources हैं, उनमें distrust बहुत ज़्यादा है, especially by families. So I'm one of the only clinical psychologists at my center, and about 30 to 40% of cases, I try my best to involve the family. Now almost 10 में से 3 या 4 cases में मैं family को involve करता हूँ, जो कि मेरे colleagues को बहुत अच्छा नहीं लगता. वो कहते हैं कि adult, वो तो adult बच्चा है, उसको क्यों तुम family को क्यों बुला रहे हो? So मेरा response होता है कि this family has raised the number of problems this kid is reporting. Solutions lie within the family, and the magic happens. Sometimes when the parents come, mother and father come, and they are sitting in front of me, I don't need to do anything. मुझे कुछ करने की जरूरत नहीं होती. लेकिन we don't have mental health professionals to do that. You know, because the Western mental health, जो कि about 150 years ago, Freudian idea था, it was very based on individualistic, infradi, fard ke upar karna. Now let me ask you one question. If you see, I'll give you a good example. Fish, machli. Agar machli ka aap dekhen aur wo, you say fish and it's not doing well. So what is the first thought that comes to your mind? Then it's not swimming, it's kind of, seems sick, it's just tucked in one corner of the pond, talab ke. What is the first thought that comes? Any brother, any sister? Yes. Change the water. Good. Would you say that, oh, this fish got depression in it. It's got anxiety. So this is my usually answer to my colleagues. When you're working with this kid, you need to work with the whole system. Okay? And that's what this is the start of this conversation. I hope you take this back to your communities, back to your circles, and advocate for more culturally nuanced, culturally based mental health services. जिसमें family को भी incorporate किया जाए. It's not, we would never have mental health professionals, enough mental health professionals to treat individuals. We need to treat our smaller units. जो घरों में घर हैं, उनमें communication के patterns, उनमें conflict कैसे पैदा होता है माँ बाप के बीच में, parents के बीच में. Okay? Speaking over Urdu, so my colleagues, if you, those who don't understand Urdu, please raise your hand and I'll translate it. The third one is financial. So the research that I conduct, we also ask when this problem started and when you're coming. So that gives us a little bit of a time idea. कि problem अब start हुआ था, कब start हुआ था? High school में, age 16 में, age 20 में, and you're coming 6 years later, right? So you're seeking treatment. Would you do the same thing for cancer? We had a very good example about cancer, about any medical issues. No, we will readily go to that. But mental health issues ऐसे हैं कि because 3 out of 5 symptoms, 3-5 में से 3 अलामत ऐसी हैं जो कि invisible, नजर नहीं आती. और ये सिर्फ depression and anxiety तो garden variety है. अब मैं मिसाल ज़्यादा पेचीदा हूँ. They are much more complex. So, and there's no OHIP coverage. Back in 60s, if you look at the history of mental health in this province, we were just a couple of votes away that OHIP will also cover mental health. It will just, the medical regime didn't let it happen. But imagine if the mental health issues are also covered by your OHIP, how much good it will do to us. Because if they don't, as brother and my good friend Maulana Umar talked about depression, WHO, World Health Organizations estimates that top 10 disability conditions, 4 of them are related to mental health. And number 2 of these lists is after cardiovascular, heart issues ke baad, is what? Depression. So the number of years that we lose due to disability are going to be due to depression, and as I said, it's a very silent killer. And we need to advocate in our community for financial support in one way or the other. The last and most important one is stigma. Abhi tak hamari community mein, I mean, it's a very good start. We are talking about mental health issues के बारे में बात करें. Again, stigma का मेरे पास कोई तर्जुमा नहीं है. Sure, कह लें. वो stigma के बहुत ज़्यादा biggest barrier है mental health के लिए हम Muslim community. Number 1 is the family says what? It's a moral failure. Maybe हमने अपने बच्चे को सही raise नहीं किया. We have faltered somewhere along raising this our daughter or our son. So there's so much stigma that even the child gets scared and they don't tell the real issue to the parents. Trust me, the kids that I see, more than 80% of them do not share this with their parents because they say, oh, my parents will feel so embarrassed. Especially even one-to-one, they don't talk one-to-one. Secondly, we don't have a very good distinction between physical and psychological. As we have pretty well-versed physical symptoms, cancer, God forbid, lekin psychological symptoms we do not know. Thirdly, we also have these myths, and some of them myths were talked by my brother Umar. We isolate these people, especially their labels. Someone has depression, someone has bipolar, someone has anxiety. So we see them differently. We don't see people with a physical illness differently. So these are the stigma. As a result, our kids, our adults, our families often suffer in silence. In the last 5 minutes, which I will devote to a couple of things which we can do about it. First of all, as I talked about throughout my talk, let's have these conversations and let's have the real issue. Let's not just skirt the surface of it. ऊपर से बात करें जो real issues हैं उनके बारे में बात करना चाहिए. Secondly, mental health का जो model we have embraced here, or most people mental health professionals embraced, it gives too much weight to negative things. I'm trained in positive psychology. We give equal weight to strengths. So tell me a human being sitting, any human being, यहाँ पे कोई भी इंसान ऐसे बैठा हो, जिसमें कोई ना कोई सलाहियत, कोई ना कोई खूबी ना हो. It is impossible. Yes, you hold grudges, but there's also gratitude. शिकवे भी हैं, मगर बहुत सी चीजों के लिए आप शुक्रगुजार भी होंगे. नहीं? बहुत सी चीजों में हमें ज़हमत होती है, पर बहुत सी रहमतें भी हैं अल्लाह की. There's blessings and there are sufferings, right? बहुत सी जगहों पे हमें conflict होता है, पर बहुत सी जगहों पे हम cooperate भी करते हैं. So mental health is, West made a great mistake about 300 years Descartes when they separated mind from the body. And I'm was wondering, and I was in awe and amazed with my much learned scholars, that we, in our prophetic traditions, in our prophetic counseling, in our Islamic fiqh, it's oneness, it's wholeness, ekiyat, jism, ruh, nafs, right? So again, I don't have the time to go into that. So my final message is to a word prevent clinically mental health. A couple of things are very important. One of them is have more family time. We're spending much more time in front of screen. Physical exercise has a very, very good result, research is showing. So sitting, actually there's an article in New York Times called "Sitting is New Smoking." Yes, अपनी नशिश पे बैठिए, मगर सोफों पे मत बैठे रहिए. And then don't just eat biryani and naan. You also need to do some exercise. And finally, very, very important, when you criticize your child, your sister, your brother, your parents, always keep in mind, they also bring, Allah has given them lots of abilities, strengths. So it is not possible that there's no one who is completely devoid. किसी के पास कोई सलाहियत ना हो. So we need to focus, keep our focus on also on the positive things. हम बहुत जल्दबाज हैं. That's why I say it. In Quran में है ना, we are very impatient. बड़ी जल्दी दूसरों के नक्स निकालते हैं. And the feedback which the child, the other people get, they internalize it और वो silence में suffer करते हैं. Always praise them, genuinely praise them. Thank you so much for your patience. I hope I did my translation right. If you have any questions, I'll be happy to answer them as well. Thank you.